So, thank you very much for everybody, for Apollo University, for Apollo Hospitals. I love India, it's a very nice place, especially Hyderabad, you know. Honestly, it's very nice, very lovely, very clean, you know. So, today I can walk you through the pathway from start to end. So, starting with the English exam and what we need to do, or we can talk about step 2, UKMLA or PLAB 2. It's according to what you want. What would you like me to do? So if you guys have not started the UK pathway, you can start it from there. If you want me to start from step 2, which is the final step to get your license in UK, I will start it from there. It's up to you. Would you like me to walk you through the pathway from the start? Yes? Okay. So, in order to come to UK, there is a pathway to come as a junior doctor, okay? As a junior doctor. And there is pathway to come as a specialty doctor. Specialty registrar, specialty general surgery. So we'll talk about, all of you look like junior doctors, right? So we'll talk about how to come as a junior doctor to practice medicine in UK, okay? So, first of all, you must have your degree in your country, in India, okay? So you cannot start this pathway when you are a medical student. Clear? You must have your medical degree along with the internship certificate, meaning you must finish your internship in order to start UK pathway, alright? It's very easy, it's very simple. Pathway is not complicated. So it's 3 steps. So 3 steps in order to get the license to work and practice in UK. Okay, do you like to write down, or you just like, because it's gonna be quite, it's better to write down if you can, because it's gonna be quite, in depth, yeah? So, how many steps? 3 steps in order to get the license to practice in UK. Step 1 is English test. So before you start anything, you have to pass an English test. The English test is called OET or IELTS. That's step 1. So English test is mandatory before you start your PLAB or UKMLA journey. Okay. Dr. Mo, you've mentioned 2 tests, OET or IELTS. What is the difference? And what do you recommend us to do? So it's always best to start or to do OET. Why? OET is way easier than IELTS. It's way easier. So either or. Either OET or IELTS. But OET is easier. But it's more expensive. So it's like 3 times the price of IELTS. But people sometimes they do IELTS 5-6 times in order to reach the mark. But with OET, just 1 shot. Clear? So English exam. Guys, you cannot start any step in UK unless you pass English exam. And I highly recommend OET. It's more expensive. It's like 3 times the IELTS. IELTS is like £120. OET is 3 times, but OET is a very easy exam for us to pass as international medical graduates. Okay? Now, after passing the English exam, and I want you to write in brackets that there is validity for English test. There is validity for the English test. It's between 2 to 3 years. Sometimes with exemption, with the GMC, 3 years, but between 2 and 3 years. And by the way, meaning you must finish the 2 steps within 2 years. So you must, for example, if you pass the English test 1st of March 2024, you have 2 years to finish your 2 steps exam. Is that clear? Hence, don't do it too early. So I highly advise if you do it after you finish your internship, when you are ready. Okay, this is the English test, and this is a must, and it is 2 to 3 years validity, and you must start it after the internship, because you cannot do these exams, you cannot get the license unless you have an internship certificate in your country. Okay. After the English test, we have 2 steps. I'm not gonna talk PLAB 1, PLAB 2 because it's now UKMLA. Step 1 and step 2. So we have 2 steps, medical exams, UKMLA. Step 1 and step 2. Okay, what is UKMLA step 1? In brackets, it's called another name, AKT. AKT, Applied Knowledge Test. This is the step 1 in the medical exams. What is this exam about? It is